Hi everybody, Joanie Somes, emergency nurse who does presentations on how to be a safer senior driver, back again with On the Road to Safer Senior Driving. And this session is about medical conditions and medications that may affect your driving. So some of the things to consider in addition to aging is medical conditions that can affect how you drive. It affects your physical condition as well as your cognitive condition. Most of us probably automatically think about the patient who has maybe Alzheimer's or dementia is at a high risk of not being able to be totally control of their vehicle. Maybe initially they be able to drive safely, but as their condition gets worse and worse, they're not going to be able to safely drive, and they're going to need to make the decision, should they be giving up the keys to their car? Not everyone has Alzheimer's. There's more than one kind of dementia, and we just all develop a little bit of cognitive impairment as we age. So recognizing that that may be happening. Someone who's had a stroke or develops limb weakness because of injuries or some other condition may not be strong enough to drive safely. A diabetic can have a variety of different reasons why they may not be safe driving. The fact that many diabetics develop neuropathies and can't feel where their foot is. They don't realize that it's not on the brake or it's not on the gas. I've even heard of times where someone who has a neuropathy actually put little post-it notes on their dashboard indicating where the pedals were, which is a little scary because they still didn't know if their foot was on the gas or was on the brake. Someone who has a stroke may have the same problem. And ultimately, there are ways to continue to drive if you go to the driver rehabilitation specialist that we mentioned in the last session. They may be able to help that driver continue to drive. Parkinson's disease will often cause some weakness. It can cause some dementia as well. And then you may look at heart and lung disease. Why would that affect my driving? Well, the reality of it is, if you have a low blood pressure or if you have a low heart rate, you may not be alert enough to be driving safely. So you need to be evaluated by your physician or ask your physician, with my condition, am I safe to drive? We'll add in a few minutes with the medications I'm on for my condition, am I safe to drive? Lastly, glaucoma or macular degeneration, loss of peripheral vision, or even loss of night vision are things I think are kind of like a no-brainer. We would recognize that. And when we go in to get our license renewed, they always check our vision, but they don't check all of these other things. We're supposed to just admit if we have them. But these are things that we need to be aware of that can make our driving less safe. And we may be able to do an accommodation in order for us to continue to drive. Also keep in mind, anybody can suddenly develop heart disease or shortness of breath or have a stroke or have a low blood sugar while they're driving and cause a crash just because of their condition. And I actually thought I'd go a little bit further and remind you it's not necessarily the condition that's making you not a safe driver. It's the symptoms of the condition. So if you have heart problems, suddenly your heart decides to do like on the screen there and stop for short little bits and then start for little bits and then stop for little bits, you may pass out. And if you pass out, you're going to lose control of your vehicle. People with really high or low blood sugar can also not be safe when they're driving. Low oxygen level because of respiratory problems, low blood pressure because of vomiting or diarrhea are all things that may happen. And then just simply that loss of sensation in your arms and legs. Remember, we need to be able to feel our feet. We need to be able to feel our hands. And how many of you hurt? And how hard is it to hurt from or to drive with your arthritis because your joints are so stiff? So all of these are things that we need to consider with driving, and they all can be related to medical conditions. Now, in addition to medical conditions, and I know this is a lot of information on a slide, but I wanted to warn you that medications can ultimately affect your driving. Opioids is the we all know that. And if you're taking antidepressants or anti-anxiety medications, those are certainly some things to think of. But know if your blood pressure medicine suddenly works too well and your blood pressure drops, or you're taking muscle relaxers and you're suddenly way too relaxed. Those are all some things to kind of think about. And while this list is not all inclusive, It's certainly something that you can kind of review, and you can talk with your pharmacist about, are the meds that I'm taking going to affect my driving? Keep in mind, the label will often say, do not drive with this medication. And I noticed my blood pressure medicine actually said, talk with the pharmacist before you take this and drive. Have you ever considered your over-the-counter medicines? Do you take cold medicines, or do you take cough medicines? Many of them can cause drowsiness as well. Benadryl is real common in a lot of different medications. You may not see it listed Benadryl, but they'll call it diphenhydramine. Can cause all kinds of slowness when you're driving. You may want to think about that. Imodium for diarrhea is another one that can cause you to be very sleepy. So be aware that just because it's not a prescription doesn't mean it's necessarily something that's not going to affect your driving. I want to scooch over to the other side of the slide and remind you that herbal or supplements are also medications. A lot of people say, well, they're natural, so they can't have any bad effects. Honestly, they have the same medicinal effects as a lot of your prescription medications. And I listed on the slide some of the common ones that people take. Melatonin to help them sleep, valerian and St. John's wort to help them relax, lavender is another one. All of these can cause drowsiness and can affect your ability to drive. So you really need to be aware of what you're putting in your mouth, what you're smoking, what you're drinking, what you're smearing on your skin, because in the long run they can affect your driving. And that's going to take me to cannabis. In Minnesota, it is now legal to use cannabis, and I'm not going to say good, bad, or otherwise. I'm just going to warn you that cannabis can either make you very excited or it can make you very sleepy, and it truly depends on the dose. And the biggest thing we're running into with our seniors is they use, especially the gummies, for pain, which is, they say, is wonderful. But you need to be aware of, if you take one gummy and you don't feel any effects and get in your car, that gummy may actually start to take effect in 45 minutes to an hour. And what happens is you're busy driving along and all of a sudden you're so sleepy, or worse yet, we're finding people are taking second and third gummies because it didn't work initially and they feel that they needed a stronger dose. So caution, if you're going to use cannabis, legal or not, you can be impaired. And I will tell you, Minnesota law enforcement is now working on a way to test for cannabis, just the same way they're testing for alcohol. So they can tell if you're overly intoxicated with the cannabis. So basically, if you look at medical problems and medications, your ability to maintain control of the vehicle is the key. Many times, medical conditions can lead you to have loss of control of your vehicle. Medications can lead you to have loss of control of your vehicle. And anytime you have a lack of alertness or ability to respond, or you have loss of strength and mobility as the result of your medications or your medical condition, you really need to think twice. Should I be driving this vehicle? Because not only are you unsafe for yourself, but you may be unsafe for the other people that are on the road. Join us next time. We're going to talk about how do you strengthen those driving muscles. I got to go dig out my lima bean cans. So see you soon.